Wondering what a mommy makeover can really do for you?
We have this patient, this woman that had pregnancies before, and we just undo all the effects that the pregnancy did to their bodies.
Meet this board-certified surgeon as he talks about safety, recovery, and what to expect.
Hi, my name is Dr. Leandro Gregorio. I'm a board-certified plastic surgeon based in São Paulo, Brazil. And I have now 5 years of experience in plastic surgery, most focused on cosmetic procedures. Mommy Makeover is kind of a commercial name that popped up a few years ago, but it's just a surgery that combines a tummy tuck with a liposuction with a breast surgery, and it can be like with implants or no implants. It depends on the patient's preference. So it's not a big deal. It's just a combination of 3 surgeries. Women after pregnancy, their body changes. So there are skin laxity, there are breast laxity, so like fat pads around the body, and it's just like due to the pregnancy process. And we just undo all the effects that the pregnancy did to their bodies. It's probably the surgery that I like the most because it has a wonderful result. It is very safe to perform those surgeries together. Of course, there are limits that we need to respect. So people that are high BMI or it's close to obesity, so it's not a good candidate for any plastic surgery. Second, people that has any kind of medical issue that is not under control. Blood pressure is not okay or diabetes is not okay, so we need to fix that first. Third, people smokers. So smokers, I do not perform any plastic surgery in people that smoke because that's going to have complications. It's not safe, and that goes for any plastic surgery, not only for mommy makeovers. First, as I told you, we need a consultation, a conversation for me to understand what you're looking for or what bothers you, because sometimes people just come and say like, I want to do this procedure, but it's just not the right procedure for you. So I need to make sure that what is the procedure that I would deliver you the best result. So since we defined your surgical plan, I'm going to guide you through a very detailed exams and diagnostics just to see if your health is okay for you to go through a procedure. So as I told you, I always work with safety first place. I need to confirm that you are able to go through under this process. So after your tests are all okay, you're good to go to the surgery. So we are going to talk about your plan. Again, I'm going to tell you everything that we are going to do to your body. I need for you to know what we are going to do. I'm not going to do anything that you're not okay with or that you do not agree with. We make together your plan. So once you agree, once you cover everything that you're expecting, then you're good to go to the surgery. Well, I take around 7 to 8 hours for a mommy makeover procedure, but it's the longest surgery that I perform. So it's around 8 hours, and yeah, that's it. I would like, after the surgery, see the patient at least 3 times before they go to their homeland. So that would be around 20 days if possible. So I ask people when they come to Brazil to have any kind of surgery, try to plan a 15 to 20 days stay after the surgery. Of course, after the patient go back to their home country, we'll keep in touch through video chats and WhatsApp messages. But yeah, I would like to see them at least 3 times before going home. I always say that like many times to my patients, plastic surgery takes long to show it results. It is around 2 to 3 months that you start seeing results after all the swelling is like going body and like the tissues are positioning. So we need to control that anxiety because we want to see the effect very early after the procedures. So actually it gets like very ugly and very weird first, but we need to trust the process. The complication that is the most common is seroma, so it's like liquid collections. So that happens very frequent for liposuction and tummy tucks. So it is the complication that I tell people. So this might happen, or there's a chance that this happens. So I always make the patients know all kind of complications that can happen. So they need to be aware of that, and they need to agree to take that risk. Of course, I have a very low rate of complications, but it's surgery, so that can happen. Most complications are very easily addressed. We do that in the follow-up consultations and through our messages. But yeah, like liposuction, tummy tuck, sometimes we have seroma that it is very easy to address and leads to no complications, like more serious complications.
MTC is with you every step of the way. For your medical or dental trip, contact MTC today.